During this presentation, I will be discussing low-dose naltrexone and its potential uses. When many individuals think of the word naltrexone, they often correlate it with opioid and alcohol dependence, in which it was FDA approved for. For these indications, the drug works as a pure opioid antagonist. These higher doses of 50 to 400 milligrams result in a continuous blockade of opioid receptors. Therefore, the patient does not experience euphoria when opioids or alcohol are consumed. For the purposes of this presentation, we will focus on LDN. The substantially lower doses of naltrexone temporarily blocks the opiate receptors, causing an upregulation in the production of endorphins. Also, LDN acts as an antagonist at toll-like receptors, and as a result inhibits the response of pro-inflammatory cytokines, thus decreasing inflammation. Naltrexone at low doses is considered an off-label use, but the list of possible uses is extensive, as you will see in the next slide. The typical maintenance dose is 4.5 milligrams daily. Low-dose naltrexone is beneficial in a wide range of disease states, and this list only encompasses a portion of those disease states. However, in this presentation, I will focus on autism spectrum disorder, gastrointestinal disorders, specifically Crohn's disease, multiple sclerosis, opioid dependency, and thyroid dysfunction. LDN is a compounded prescription product that requires an order from the doctor. A compounding pharmacy is able to compound any of the following dosages for the patient to fit his or her specific needs. It can be compounded as various capsule or tablet sizes, or for patients that are unable to tolerate oral formulations, a liquid, sublingual drop, or cream can be compounded. So what are the side effects associated with low-dose naltrexone? There are very few side effects associated with it. However, the most common side effects are insomnia or vivid dreams, which typically subside after about 2 weeks. The other side effects listed on the slide are associated with the higher doses in which the FDA indication is for. So at doses of 50 to 400 milligrams a day, a patient may experience stomach cramps, diarrhea or constipation, headache, shivers, or chills. And now we will transition into specific disease states, and first up is thyroid dysfunction. LDN is useful in both ends of the spectrum in thyroid dysfunction because an overactive immune system is a defining attribute to both. Therefore, it's useful in both Hashimoto's thyroiditis and Graves' disease. The suspected mechanism is that it improves the transport of thyroid hormone into the cells and facilitates T4 to T3 conversion. Patients report improved energy, improved concentration, improved weight management, and decreased hair loss, which are often main complaints of individuals with thyroid dysfunction. Something to note is that individuals with Hashimoto's disease are typically more sensitive to low-dose naltrexone than patients with other diseases are. For this reason, they may need to start at a lower dose of 0.5 milligrams a day and titrate slower than other patients. If titrated too quickly, these patients may experience thyroid toxicity or hyperthyroid symptoms. LDN may also be beneficial in Crohn's disease. It inhibits cell proliferation and lymphocyte response, and as a result of this inhibition, there is decreased inflammation in the colon. Dr. Jill Smith conducted a clinical trial on LDN in Crohn's disease that consisted of 17 patients treated with 4.5 milligrams of naltrexone daily for 12 weeks. As a result of the treatment, 89% of patients responded and 67% achieved remission. The depiction on the slide is from Dr. Jill Smith's work. The left picture indicates active Crohn's disease before starting therapy. You can see that the mucosa is ulcerated, edematous, and inflamed. And the right image is a result of the 12-week treatment with 4.5 milligrams of naltrexone daily. The lining and ulcers have healed, and the mucosa is now healthy. LDN may also be beneficial in children with autism spectrum disorder or ASD. Children with ASD are thought to have a beta endorphin dysregulation, and it is suspected that LDN normalizes the levels of beta endorphins within the body. A child affected by autism may benefit from a trial of naltrexone therapy, particularly if the child exhibits self-injurious behavior, hyperactivity, and irritability. Dr. McCandless did a lot of work with LDN in her time, and she reports that LDN at a dose of 1.5 milligrams to 4.5 milligrams daily applied as a cream resulted in 8 patients having a positive response and 5 of the 8 having significant improvement. She reported that the primary positive responses involved mood regulation, cognition, language, and socialization. LDN may also be utilized in opioid dependency. The use of LDN in opioid-dependent patients sounds contradictory, as naltrexone is an opioid blocker. However, an ultra-low dose of naltrexone is utilized to potentiate the effects of the opioid, decrease the opioid dose and associated dose-dependent adverse effects, and avoid withdrawal. The temporary partial inhibition of opioid receptors results in increased endorphin release, increased sensitivity of existing opiate receptors, and formation of additional opioid receptors. Therefore, a dose of 1 microgram twice daily in individuals with chronic opioid use may be indicated. There is an abundant amount of research on the use of LDN in multiple sclerosis. The suspected mechanisms are that it restores the balance of T lymphocytes, reduces painful symptoms and increases the sense of well-being, and offers neuroprotection through glial cell activation. A clinical trial was conducted to evaluate the efficacy of LDN on the quality of life of MS patients. A dose of 4.5 milligrams nightly was utilized. As a result of the LDN therapy, there was a 3.3 improvement on the Mental Component Summary Score, which is a 36-item questionnaire which measures quality of life across 8 domains, which are both physically and emotionally based. Additionally, there was a 6-point improvement on the Mental Health Inventory Scale, which evaluates issues such as anxiety, depression, behavioral control, positive affect, and general distress. And lastly, there was a 1.6-point improvement on the Pain Effects Scale, which is an assessment of the ways in which pain and unpleasant sensations interfere with mood, ability to walk or move, sleep, work, recreation, and enjoyment of life. And now we move on to the prescribing protocol for typical conditions. Most individuals will utilize a 3 milligram scored tablet starter pack. In week 1, they will use a half a tablet or 1.5 milligrams a day. Week 2, they will then increase to a full tablet of 3 milligrams daily. In week 3 and thereafter, they will utilize a 4.5 milligrams daily or 1.5 tablets. As I mentioned previously, dosing in hypothyroidism is different than typical conditions. Individuals may utilize a 1 milligram or 3 milligram scored tablet depending on the physician's preference. On week 1 and 2, they will have a half tablet of the prescriber's choice. And then on week 3 and 4, they will have a full tablet. And then 5 and thereafter, they will either achieve a 1.5 milligrams or 4 milligrams daily. If using the 1 milligram scored tablet, the dose is increased based on patient tolerance up to a maximum of 4.5 milligrams daily. When utilizing naltrexone in opioid dependency, an ultra-low dose is utilized. It is a 1 microgram capsule utilized twice daily. Thank you for your time.